Good afternoon, everyone. My name is Marlene King, and I wear three hats. The first one is my husband. I'm married to my husband, Eric King. We have three awesome sons. The youngest is about to graduate from Frostburg State University with 2 degrees, and we're so excited. And two grandchildren. And then I'm a board member for METAvivor, which is an organization that does grant for researchers who are looking into metastatic breast cancer, so that hopefully in the near future it will be more chronic disease than a fatal disease when you hear that you have metastatic cancer, whatever that may be. Shared decision, making it as a patient. So in 2008, I was diagnosed with breast cancer. I had a lumpectomy, some re-excision, chemotherapy, and radiation. After which my doctor thought I was fine, everything was going well. 3.5 years later, it came back in the same breast, and my surgeon suggested that I remove it. So I said, well, just remove both of them. I don't need them anymore. I'm okay with it now. Let's move on. And it was interesting because about almost a year later, leading up to that, but almost a year later, I felt something really interesting in my sternum, in my breastbone. And I said to my husband, this feels really weird. It wasn't a lump, it wasn't hard, it wasn't anything, it was just weird. And my husband and I were walking out of our oncologist office. And he said, by the way, Dr. Donegan, he said this, Marlene has been complaining about her chest. And Dr. Donegan said, well, you know, I don't think it's anything, but let's just do an x-ray just for the heck of it, just so we're okay. And it came back, it showed that I had metastasized in my breastbone area. And also when I did a PET scan, I had it in both my lungs and in my liver. Since 2008, Dr. Donegan and I have made shared decisions. He did not force anything on me that I did not want to have done. As a matter of fact, last summer, I became very ill. And I thought it was the medication. I had been on 7 different medications because nothing was working. And he said to me, I think we need to continue with this medication. And I said to him, I don't know if this medication is making me sick, but I am sick. I'm not eating, I'm losing weight, I just need to stop. And he said to me, Marlene, whatever you want to do is fine. But honestly, I think we should continue with this. And I said, Dr. Donegan, I understand you're an oncologist. You are supposed to fix me, not a problem. I said, but I need the summer off. I need to get my body back to some kind of normalcy. I need to get all of the toxicity out of my body a little bit, and I need to move on. So he said, fine, I'll just check you once every 2 months. And that's what we did. Then in October of last year, I went back on, and we're fine. Now, to give you a totally different scenario. When I was diagnosed in 2012 with metastatic breast cancer, my mother was diagnosed with ovarian cancer, metastatic. And it was so bad that when the doctor found out she had it, they did a pap smear, and when the doctor went in, nothing but blood and clot came out. That's how severe it was. We knew how severe it was. And being that I've been in the process of knowing what it's like to have chemo, radiation, surgery, knowing and having a relationship with a doctor who included me in everything, every treatment that I've taken over the last few years, he and I have made that decision. This particular surgeon said, okay, let's give my mom surgery, which we all agree with. And then he kept forcing onto my mom and onto us that she needs to have chemo. Knowing that what I know and having a shared decision with my oncologist, I said to him, what good is this going to do for her? Considering how bad the cancer is it really worth it? He said, he cannot say yes or no, but maybe a 25% chance. I said, my mom said to us she wants quality and not quantity. She wants to live the rest of her life, however many months she has, with her children, her grandchildren, her great-grandchildren, her grandnieces, her grandnephew. And the doctor was quite upset. But I said, you know what? Mom, it's your decision. My sister also said the same thing. And being that my mom's seen what I went through with chemo, she says, I don't want to do that. She said, let me just have a great life for the rest of my time. And so it was. The surgeon was very upset with us. The doctors that he brought in kept trying to hammer into our heads that we should do this chemo. And we totally said, no, this is the decision that we have come to. We're not going to do the chemo. So on one hand, my doctor shared decision. We love him. If I could marry him and move him in, we would. Sorry, sweetie. On the other hand, we have seen where a doctor will try to force something on a family without really sitting down and giving them understanding of what is taking place. And if I still do have time, my husband and I just went to see my oncologist because now I have to do a new treatment because unfortunately the old treatment wasn't working, so here we go again. And he sat with us for about an hour, and if not longer. And I said to him, you know, I'm going to this event, and we're going to be talking about patients and doctors and so on and so forth. And he says, Marlene, it's very difficult when you have so many cancer patients. And as good as I am, I'm only one person. And if I take time with this patient, that means I'm running behind. But I said to him, do you know something, Dr. Donegan? I'd rather sit here and wait a half an hour for you because I know you're going to spend that extra time with me. You're not going to try to run out of here to get to the next patient. And I think the other patients understand that the half an hour that you have taken with them, that's what you're going to do to the other patients. And there's a big difference. I would rather sit and wait for my doctor to come in and talk to me as a person, as a patient, as someone he understands, as someone that I understand that he is a doctor and I do value his opinion, than have somebody come in late, see me for 5 minutes, and then in rushing out the door to the next patient. So I don't know if you can take anything away from that, but that's how I feel. That's how my husband feels. And that's why we love our oncologist so much. Great guy.
Thank you. Good afternoon. Not only am I Marlene's husband, but I am a clergy, been in ministry 26 years, so I spent a lot of time in hospitals. The last speaker shared something that I'm very concerned as well as passionate about. And are doctors good listeners? I come in and say I have a pain in my arm. Well, use Marlene. When she talked about the raise in her sternum, the doctor could have said, well, that's just something that's left over from chemo, as opposed to probing with more questions as done. Somewhat medical people like pastors, we got quick answers or short answers. But there's a need for compassionate care, and that has to be taught, I think, by, or the medical people need to be educated on how to be compassionate, to walk alongside the patient, and as opposed to seeing what the research will bear out for the future, to take this one patient as if that's the only one that they have. Marlene and I went for a different reason to the Cancer Treatment Center in Philadelphia, and we did a comparison on what they say that they offer as a team concept versus what she's getting at Greater Baltimore Medical Center. Greater Baltimore Medical Center was heads and shoulders above the treatment center in Philadelphia. No disregard, it was an excellent program, but thinking in terms of the doctors listening, the doctor's care, the doctor's response, follow-up phone calls with Marlene at home, taking time to talk with me. Marlene is learning this for the first time after our last visit. As she left the office, Dr. Donegan asked me to step back in and ask me, so what's our conversation like? And I was able to share from a caregiver's perspective what Marlene was sharing with me, or what she may have said were her personal thoughts, which will help him in caring. So some of this goes back to medical school, as was already shared, that doctors get a little more education in regards to offering compassionate care.